Imagine a world where type 1 diabetes can be delayed or even prevented. A groundbreaking new drug, Teplizumab, also known as TZIELD, is making this a reality. Could this be the game changer we've all been waiting for in the fight against type 1 diabetes? In this video, we're diving deep into how Teplizumab works, its incredible effects, and what the latest research says about this revolutionary treatment. Teplizumab, marketed as TZIELD, has been hailed as a breakthrough in the world of type 1 diabetes. This drug is the first of its kind to be approved by the FDA to delay the onset of type 1 diabetes in high-risk individuals. The idea of being able to intervene in the autoimmune process that leads to type 1 diabetes is groundbreaking. In clinical trials, Teplizumab has shown the ability to delay the progression to insulin dependence by an average of 2-3 years, offering a crucial window of time for patients and their families. For those at high risk, like individuals with a family history of type 1 diabetes or specific genetic markers, Teplizumab provides a glimmer of hope, changing the way we approach this autoimmune disease. So, how does Teplizumab work its magic? Teplizumab is a monoclonal antibody that targets CD3, a molecule found on the surface of T cells. In type 1 diabetes, the body's own T cells mistakenly attack and destroy insulin-producing beta cells in the pancreas. Teplizumab modifies the T cell response, essentially, retraining the immune system to slow down or halt the attack on these crucial beta cells. By binding to the CD3 receptor, Teplizumab alters the behavior of these T cells, inducing a more regulatory phenotype. This process helps in preserving the remaining beta cell function, reducing the autoimmune assault on the pancreas. This immune modulation is what makes Teplizumab a unique and innovative treatment option for type 1 diabetes. Teplizumab is administered through an intravenous infusion. The treatment course is usually completed over 14 days, with the dosage adjusted based on body surface area. Here's a typical dosing regimen. TZIELD is administered by IV infusion, over a minimum of 30 minutes, once daily for 14 consecutive days. The recommended TZIELD dosage for adults and pediatric patients aged 8 years and older uses body surface area-based dosing and is administered according to the following regimen in microgram per meter square. Day 1, 65. Day 2, 125. Day 3, 250. Day 4, 500. Days 5 to 14. 1030 TZIELD is a clear and colorless solution supplied in a 2 mg per 2 ml, single-dose vial. It's important to note that the dosage is carefully calibrated to minimize side effects while maximizing the drug's effectiveness. Dose adjustments may be necessary in certain situations, such as if the patient experiences significant adverse reactions. This is why administration is done in a controlled healthcare setting, where patients can be closely monitored. While Teplizumab offers significant benefits, it also comes with potential adverse effects. The most commonly reported side effects include cytokine release syndrome, CRS, characterized by fever, fatigue, and headache. CRS occurs due to the activation of immune cells and the release of inflammatory cytokines. In most cases, CRS is mild and manageable, but it requires careful monitoring. Lymphopenia, a reduction in white blood cells, particularly T cells, which can make patients more susceptible to infections. Rash, skin rashes can occur, though they are generally mild and self-limiting. Infections, due to its immunomodulatory effects, there is a slight increase in the risk of infections. Patients undergoing Teplizumab treatment should be closely monitored for these side effects, and supportive care should be provided as needed. The benefits of delaying type 1 diabetes onset need to be weighed against these potential risks on an individual basis. The impact of Teplizumab has been studied extensively, with impressive results. A pivotal trial published in the New England Journal of Medicine in 2019 showed that Teplizumab significantly delayed the progression to clinical type 1 diabetes in high-risk individuals. Moreover, a follow-up study demonstrated that a single course of Teplizumab can provide a durable effect, delaying the onset of type 1 diabetes for an average of 2-3 years. These results have profound implications, particularly for children and young adults who are at high risk of developing type 1 diabetes. Delaying the onset of the disease can mean postponing the lifelong burden of insulin dependence and its associated complications. In summary, Teplizumab, TZIELD, represents a significant breakthrough in the management of type 1 diabetes. Its ability to delay the onset of the disease offers hope to individuals at high risk, providing them with a valuable window of time before the challenges of insulin dependence begin. While there are potential side effects to consider, the benefits for those at high risk of developing type 1 diabetes are substantial. Teplizumab isn't a cure for type 1 diabetes, but it's a crucial step toward changing the course of this autoimmune disease. As research continues and our understanding of the immune system deepens, we may see even more advances in treatments that could one day prevent type 1 diabetes entirely. Thank you for watching. If you found this video informative, please like and subscribe to The Diabetes Professor for more updates on the latest in diabetes research and treatment. If you have any questions or experiences with Teplizumab, leave them in the comments below. Let's keep the conversation going.